Welcome to Elder Zen. Hit subscribe for simple health tips made just for seniors. Stay tuned. Your next great day starts here. Have you ever paused, just for a moment, as you line up your daily pills, holding them in your palm, and wondered, dare these little tablets truly my shield? Or could they, in some hidden way, become a sword? For so many of us, especially those navigating the rich, complicated landscape of life after 60, the ritual of taking medication is as natural as breathing. We do it to stay well, to keep blood pressure in check, to ease aches, or find precious sleep at night. We do it because we want more years of independence, more days spent with loved ones, and more moments that matter. And yet, beneath the surface of this daily act is a question we rarely dare to ask. Could something meant to heal also cause harm? If this thought has ever crossed your mind, let me assure you you're in good company. Millions of older adults rely on prescriptions to manage chronic conditions and live fuller lives. But here's a crucial truth. Some of the very medicines designed to help can quietly, almost invisibly, increase your risk of blood clots. These clots are often silent, but their impact can be swift and life-altering. What if I told you that the answer might be found not in fear, but in a simple questionnaire, even a conversation with your doctor or pharmacist? Sometimes it's a small warning label or a single change in your medication that draws the line between an active, vibrant tomorrow and an unexpected emergency. Today, we're pulling back the curtain on a topic every senior, every caregiver, every person who loves someone over 60 needs to understand: the hidden connection between medication and blood clots. You'll discover the science behind why this happens, hear true stories from people just like you, and gain tools to make safer, smarter choice ways in partnership with your healthcare team. We'll explore which medications are most likely to raise your risk, why some people are more vulnerable, how you can tell if you're one of them, what questions you should be asking at every checkup and pharmacy visit, and most importantly, what you can do, starting right now, to stay protected while still getting the benefits you need. If you've ever wondered, even for a second, whether your daily pills could be doing more than you bargained for, this episode is made for you. So please, settle in with a cup of tea or coffee, maybe a notebook by your side. Together, let's dive deep into this life-saving knowledge. Not with worry, but with the quiet power that comes from understanding and action. Because when it comes to your health, the best protection starts with the right question. Before we unravel which medications can raise your risk, let's step back and understand the basics. What is a blood clot, and why do they become such a threat as we age? A blood clot, medically known as a thrombus, is your body's ingenious way to plug leaks when you get a cut or injury. Imagine your blood as a river. When a breach appears, your body creates a clot, stop the bleeding. But sometimes, a clot forms inside a deep vein where it's not needed. Most often, these clots hide in the legs, a condition called deep vein thrombosis, or DVT. The real danger emerges when a piece of that clot breaks off, traveling like a silent passenger through your veins until it lodges in your lungs. This is called a pulmonary embolism, or P blockage, that can stop the flow of blood and oxygen, sometimes with almost no warning at all. Why is this a special concern for older adults? Aging changes our veins, making them less flexible and resilient. Our blood moves more slowly sometimes because of illness, sometimes because we sit or lie down more. Chronic health problems, so common after 60, can thicken the blood or slow its flow even more. Layer on reduced activity from a surgery, a long car trip, or even just a week of taking it easy, and the risks rise higher still. But the most troubling fact: many clots form in silence. The first sign may be a little swelling or pain or nothing at all until a crisis occurs. So, what does this have to do with your medications? Far more than most people realize. A surprising number of everyday drugs both. Those your doctor prescribes and those you buy over the counter can shift your bodies. Natural balance between clotting and thinning. Some nudge your blood toward being thicker and stickier. Others, through side effects or interactions, slow your circulation or affect how your body processes injury and inflammation. Let's break down what happens inside your body. Point 1. Blood is always moving. Anything that slows its bed rest, surgery. Long periods of sitting makes clot formation more likely too. The body carefully balances clotting and thinning. Some medications, by design or accident, push this balance toward clots. 3. Hormones, cancer drugs, heart and pain medicine. So, can tip the scale as we age. Our bodies become more sensitive to these shifts. Even a medication that was safe in your 50s may have a different effect in your 70s or 80s. That's why it's never been more important to really understand what's in your medicine cabinet and how your daily choices affect your future. Are you ready to look closer at the pills you take? Up next, we'll reveal which common medications increase clot risk, why seniors are particularly vulnerable, and what you can do to take control of your health, one question at a time. Now that we've set the stage, let's walk together through the world of medications that could quietly be tipping your balance toward clotting. If you open any medicine cabinet in a home where someone over 60 lives, you're likely to find a patchwork of bottles, some for blood pressure, others for arthritis, perhaps a few for sleep, mood, or even hormones. Each pill was given with care, meant to soothe pain, strengthen a heart, or restore restful nights. Yet, beneath the surface, some of these trusted companions have a hidden city on we need to talk about openly. Let's start with hormone medications. Many women are prescribed hormone replacement therapy, or HRT, to ease the symptoms of menopause. Estrogen, one of the main ingredients, is known to increase clotting risk. This doesn't mean hormone therapy is bad. In fact, for some, it's life-changing. It does mean your doctor should carefully weigh the benefits and the risks. The same is true for testosterone therapy, which some men use to address a age-related hormonal decline. Even certain birth control pills, though less common in this age group, might be prescribed for hormonal imbalances or other health issues. The bottom line? Any medicine containing estrogen or testosterone needs extra caution in seniors. To quote Dr. Janet Britton, an endocrinologist who's worked with patients for decades, any medication containing estrogen or testosterone should be monitored closely in older adults, especially those with a personal or family history of clots. Her words are a gentle reminder that our stories are his stories matter, just as much as our prescriptions. Next, let's talk about cancer treatments. If you or someone close to you is going through cancer, you know the journey is already hard enough. Many chemotherapy drugs, hormone-blocking pills, and even some of the newest, most targeted treatments can make your blood thicker, increasing clot risk. And here's the double challenge. Cancer itself raises the odds, so seniors with cancer face risk from both the disease and the drugs. Consider Evelyn's story. At 72, she was navigating breast cancer treatment with courage and optimism. But when her legs suddenly swelled and became painful, she was stunned to discover she had a deep vein thrombosis, a dangerous blood clot, likely triggered by her medication. I never thought the medicine that was fighting my cancer could also put me in harm's way, she shared. Evelyn's experience reminds us to stay alert and informed, even when the journey feels overwhelming. Then there are the steroids and anti-inflammatory medications so many rely on for arthritis, asthma, or back pain. Medicines like prednisone or dexamethasone, especially in high doses or for long periods, can raise blood pressure, elevate cholesterol, and yes, make the blood more likely to clot. Over-the-counter NSAIDs, such as ibuprofen or naproxen, may seem harmless after all. They're sold in every pharmacy, but they, too, can shift your body's balance. It's a delicate dance, and one that deserves regular check-ins with your doctor. Let's not forget heart medications and diuretics. Drugs for heart disease, irregular rhythms, or high blood pressure can affect how much water and salt your body holds. If you become even mildly dehydrated, your blood thickens, and the risk of clotting grows. Those with heart failure or limited mobility are especially vulnerable. A reminder to always keep hydration and regular movement in mind. Now, we turn to mental health medications. Life after 60 is rich with emotions, joys, and sorrows, changes, and challenges. Some antipsychotic drugs, as well as certain antidepressants, have been linked to a modestly higher risk of clots. This isn't a reason to stop taking the mental health is too important to neglect, but it is a reason to share your full medication list and history with every healthcare provider you see, and remember, it's not just the prescription bottles. Over-the-counter drugs and herbal supplements can also play a role. NSAIDs, sleep aids, and some herbal remedies may interact with your regular medicines in ways that quietly tip the scale toward clotting. Never forget to tell your doctor about everything you take, even if it's just a natural product or something recommended by a friend. So, who is most at risk? The answer, as you might guess, is not always straightforward, but generally, those with a history of clots, those who are overweight, smokers, people with cancer, heart disease, or chronic inflammation, and anyone with reduced mobility are at higher risk. Seniors often have more than one risk factor at a time, simply because of age, illness, and the number of medications they take. But let's be clear. The answer isn't to stop your medications without guidance. Many of these drugs are essential for your health and well-being. What matters is awareness and partnership. Bring a complete, up-to-date list of every pill and supplement you use to every doctor's visit. Don't be afraid to ask, could any of these increase my risk for blood clots? Or are there alternatives with less risk? That small question, spoken with curiosity and care, could spark a conversation that keeps you safe. In our next segment, we'll look closer at why older adults more than any other group must stay vigilant when it comes to medication-related clots, and how the changing landscape of aging shapes every decision we make. Now, let's slow down and ask an honest question. Why do medications and the risks they bring affect seniors differently than younger people? Why does age so often tip the scales? The truth is, getting older brings profound changes not just in how we look or feel, but deep within our bodies, where blood flows, organs filter, and cells communicate in a language all their own. As we age, our blood vessels lose some of their youthful elasticity. Think of them like garden hoses that, after years in the sun, just aren't as flexible. The blood that once flowed quickly and freely now moves a little slower, navigating those twists and turns with less vigor. But that's only the beginning. The heart, too, changes with time. It might not pump as forcefully or as efficiently, especially if you've weathered high blood pressure, cholesterol issues, or even minor heart attacks along the way. Blood is meant to move, and when it slows down, whether from natural aging, a long illness, or even a simple stretch of sitting still, it's more likely to pool and thicken, creating a perfect stage for a clot to form. The kidneys and liver, those unsung heroes of a special mention. These organs work tirelessly, day in and day out, to filter toxins and process nearly every medication you swallow. But aging is tough on them. Their function naturally slows, sometimes without any symptoms at all. What does this mean for medications? Quite simply, drugs stay in your body longer, sometimes reaching higher levels than your doctor intended. Some become stickier, accumulating and interacting with other pills in unpredictable ways, especially when it comes to those affecting blood flow and clotting. Now, let's talk about mobility and muscle loss. You probably know that moving less is bad for your health, but most people don't realize just how closely movement and blood health are linked. The simple act of walking, shifting in your seat, or flexing your ankles helps keep blood circulating. When you're sick, recovering from surgery, or just having a low-energy day, you may spend more time in bed or in your favorite chair. That stillness, combined with the effects of certain medications, can let blood settle and thicken specially in the deep veins of your legs. Add to this the reality that most seniors take more medications than any other age group. It's not uncommon to have 5, 6, or even 10 different prescriptions, each doing its job, but sometimes combining in ways that raise the risk for clots. Maybe one pill is thinning your blood, while another is thickening it. Maybe a pain reliever interacts with a water pill, changing your fluid balance. Every new medication adds a layer of complexity. Even your pharmacist or doctor may not catch every potential interaction, unless you bring your full list and ask questions. Let's Not Forge a Life brings challenges too. Surgery, fractures, hospitalizations, cancer treatments, periods of immobility. After a fall or illness, these experiences are far more common as we age. Each one can make the body more vulnerable to clots, especially when layered with medications that already increase the risk. But this is not a reason to feel afraid or overwhelmed. It's a reason to be wise, proactive, and compassionate with yourself. Knowledge is power, and being aware of these changes means you can partner more effectively with your healthcare team. You can recognize warning signs sooner and make small adjustments like moving more or drinking extra water. That can make all the difference. If you're caring for someone, older, a parent, a spouse, a friend, your role is vital. You can check in, offer encouragement, and help with organizing pillboxes or preparing questions for the doctor. Sometimes, just having another set of eyes and ears can mean the difference between a small problem caught early and a bigger one missed until it's too late. Let's remember, aging is a privilege, not a weakness. Your body is adapting to a new stage, and your wisdom and experience can guide you to safer, healthier choices. As we continue, let's look together at the subtle warning signs of blood clots, so you can spot problems early and act before a crisis arises. As we reflect on all these changes in the aging body and the complex dance of multiple medications, it's clear that knowledge is our most trusted companion. But knowledge is only useful if we know what to look for. We can recognize the gentle tap on the shoulder before it becomes a shout. So let's turn now to the warning signs, those subtle messages your body may be sending, sometimes in whispers, sometimes in more obvious calls for attention. Now, you might be asking yourself, how would I know if a blood clot is forming? Or aren't all aches and pains just a part of getting older? These are natural questions, and it's true that life after 60 brings its share of new sensations. But certain clues are too important to ignore. Let's shine a gentle spotlight on them so you can become a better listener to your body's signals. Let's begin with deep vein thrombosis, or DVT, as you might hear your doctor say. This is when a clot forms deep in the veins, most often in the legs. It can happen quietly, even while you're resting or recovering from an illness or surgery. But sometimes, the body sends out small distress signals. Maybe you notice swelling in one leg, not explained by a bump or fall. Perhaps there's a tightness or pain that just won't go away, especially when you stand or walk. Sometimes, the skin over the area feels warm, or you see a patch of redness or a bluish hue. To illustrate, let me share a story. Jim, who's 68 and still loves to tinker in his workshop, noticed his calf was swollen and sore one morning. He brushed it off as a pulled muscle at first, something he'd done 100 times. But when the swelling didn't fade and his leg felt hot to the touch, he listened to his gut and called his doctor. That decision, simple as it seemed, made all the difference. Jim was quickly diagnosed with a DVT and treated before the clot could travel. Which brings us to another vital point. What happens when a clot does move, traveling through the bloodstream to the lungs? This is called a pulmonary embolism, or PEM. The signs can appear suddenly. Shortness of breath that doesn't improve with rest. A sharp pain in your chest, especially when you breathe deeply, or a rapid heartbeat that seems out of place. Sometimes people feel dizzy, lightheaded, or even faint. Others develop acostomy times. With a bit of blood, it's easy, in the moment, to wonder if you're just winded from activity, or if that little twinge is nothing. But I want you to know, even mild symptoms matter. Every person's body is unique. Sometimes the only sign is a vague fatigue or the sense that something isn't quite right. If you've recently started a new medication or your prescriptions have changed, be especially attentive. Jot down new symptoms, no matter how small, and share them with your doctor or pharmacist. Here's another important truth. The earlier you notice a problem, the more options you and your healthcare team have. Waiting often makes treatment harder. Acting early can be life-saving. Let's imagine a scenario many of us have faced. You're recovering from a procedure, taking new medicines, and feel a little off, maybe just a slight swelling or a sense of tiredness you can't shake. You think about waiting a day or two. Instead, you call your doctor just to be sure. That simple act could save your life. Blood clots caught early are treatable. Left alone, they become far more dangerous. So what's the takeaway? Trust yourself. You know your body better than anyone else. If you feel something is wrong, don't ignore that voice. And remember, asking for help or advice is not weakness, it's wisdom. As we move forward, keep these warning signs in mind. Next, let's talk about how to turn this knowledge into action. Practical steps for discussing medication risks with your healthcare team so you can stay safe while still getting the benefits you need. Now that we understand what to watch for, you might be wondering, what do I actually do with this information? Here's where your voice becomes your most important tool. Navigating medications and potential risks can feel overwhelming. But starting an honest, thoughtful conversation with your healthcare team can transform anxiety into confidence, confusion into clarity. Let's face it, doctor visits can feel rushed. Maybe you've left an appointment only to remember a question you meant to ask, or felt too shy or unsure to bring up a concern. That's ever happened to you? You're not alone. The key is to come prepared, and to remind yourself that you are not just a patient here, a partner in your care. So, how do you make these conversations effective? Let's begin with a simple but powerful step. Bring a complete, up-to-date list of all your medications, including prescriptions, over-the-counter remedies, and supplements. It's amazing how often this detail gets overlooked. Yet it's absolutely crucial for your doctor and pharmacist to see the full picture. Keep this list handy, update it regularly, and don't hesitate to share it at every visit. When you sit down with your doctor or pharmacist, try asking direct questions. It might feel awkward at first, but these conversations can open doors to better, safer care. For example, could any of my medicines increase my risk for blood clots? Warning signs should I watch for, and when should I call for help? Are there any safer alternatives for me, considering my age and health history? These questions aren't just for yucky help your providers too. When you ask, you invite their expertise and attention, making it easier for them to spot potential problems early. Don't forget to share your medical history, not just your own, but your family's too. A history of clots, strokes, or heart attacks in close relatives can change your risk profile and influence the choices your doctor makes. If you notice new symptoms, welling pain, shortness of breath, or anything that feels different, and wait until your next appointment. Call, leave a message, or use a patient portal if your doctor's office has one. Early communication can head off bigger problems down the road. And here's another tip. Regularly review your medication list with your doctor or pharmacist. What was once the right medicine may not be the best option now. Health conditions change, new drugs become available, And sometimes, we simply don't need as many prescriptions as we once did. It's okay to ask, is this still necessary? Is there a way to simplify or reduce my medications safely? If you feel hesitant to speak up, remember that your care team wants to help, but they're also busy and see many patients each day. By advocating for yourself, you make their job easier and your outcomes better. In fact, many pharmacists say they appreciate patients who come with questions and lists. It means you're invested in your own well-being. Let's not forget caregivers and loved ones. If you're helping a senior in your life, offer to go to appointments, jot down notes, or help them organize their medication information. 2 sets of ears are better than 1, and sometimes, having support in the room makes all the difference. If this feels like a lot, just take the first step. Maybe today, you update your medication list. Tomorrow, you bring it to your pharmacy or doctor's office. Next time you have a visit, you ask one new question. Every small action builds your confidence and keeps you safer. Now, with your new skills in asking questions and sharing information, let's look ahead. What practical daily steps can you take no matter your medication list'll help lower your risk for dangerous blood clots? Let's explore together in our next segment. As we journey together, remember this: while some risks may seem beyond your control, you actually have more power than you think. It's not only about the medicines you take, it's also about the small, mindful habits you weave into every day. These choices are the thread that can help safeguard your health and your independence, even if you must continue with high-risk prescriptions. So, what can you do starting today, right where you are? Let's begin with the simplest, most effective strategy of all. Move often, even in small ways. Maybe you picture exercise as something formal or strenuous, but for most of us, it's the little movements that count the most. If you're watching TV, set a gentle reminder to stand up and stretch every hour. If you're reading, listening to the radio, or chatting on the phone, try a few ankle rolls or gentle foot pumps. Picture the blood in your legs as a slow-moving stream. Every movement helps keep it flowing, lowering the chance of clots settling in. Even a short walk to the kitchen, a lap around your living room, or a few stretches at your bedside each morning can make a difference. For those who are less mobile, chair yoga or stretching routines can be just as helpful. Remember Harold, whom we met earlier, who started with a walking lap inside his home after surgery. Those steps not only rebuilt his strength, but also helped keep his blood moving safely. Another simple but essential habit: stay hydrated. Our bodies are made mostly of water, but it's easy to forget to drink enough, especially as we age and our sense of thirst can decrease. Dehydration makes blood thicker, which increases the risk of clots. Make it a goal to sip water throughout the day, not just when you're thirsty. If plain water isn't appealing, try adding a slice of lemon, a few berries, or sipping herbal tea. Maintaining a healthy weight is another step with many benefits. Excess weight puts extra pressure on your veins and can slow blood flow from the legs back to the heart. You don't have to make dramatic changes overnight. Even a small reduction can lighten the load on your circulatory system. Celebrate every healthy choice, whether it's choosing fruit over processed snacks or taking a few extra steps during your day. Next, let's talk about what's on your plate. A balanced diet in fruits, vegetables, whole grains, and lean proteins nourishes your blood and vessels. Some foods, especially leafy greens, naturally support blood flow. But talk to your doctor if you're on blood thinners, as sudden changes in vitamin K intake may require adjustments to your medication. Limit processed foods and high-salt snacks, which can worsen swelling and increase blood pressure. Keeping track of your health numbers like blood pressure, cholesterol, and blood sugar is equally important. Monitor your results and tell your doctor about any significant changes or new symptoms. Sometimes, early adjustments to medication or lifestyle can prevent bigger problems down the road. Don't underestimate the importance of knowing your family history. If your parents, siblings, or children have had blood clots, strokes, or clotting disorders, mention this to your doctor. You may benefit from closer monitoring or preventative steps tailored just for you. And above all, follow your medical instructions carefully. Never stop or change your medications on your own. If you have concerns about side effects or risks, bring them up at your next appointment. Your healthcare team wants to work with you to find the safest, most effective plan for your unique needs. Sometimes, it's the consistency of small actions done over time that make the biggest difference. These steps, moving, hydrating, eating. Well, tracking your numbers aren't about restriction or punishment. They are acts of kindness toward your future self. Quiet commitments to the life and freedom you value. So as we approach the final chapter of our conversation, let's take inspiration from real stories of resilience and learning. In the next segment, we'll hear how ordinary people, just like you, recognized the risks, took action, and made a real difference in their own lives and, sometimes, the lives of those they love. Ready to be inspired? Let's move forward together. As we draw nearer to the end of our conversation, let's take a moment to honor the lived experiences that teach us best. Statistics and medical advice are powerful, but sometimes it's a personal story that truly sparks change. A moment when you recognize yourself or someone you love in another person's journey. Meet Linda. For most of her working life, Linda was a nurse, a role that demands not just skill, but deep empathy and an eye for detail. She spent decades caring for others, comforting patients, and teaching families how to watch for signs of trouble. But when it came time for her own retirement, Linda, like so many, found herself facing new health challenges of her own. After a minor surgery, Linda was prescribed a mix of painkillers and hormone therapy. She followed her doctor's instructions, confident in her knowledge and the routines that had guided her throughout her career. But about 3 weeks into her recovery, she began to notice something strange. Her left calf felt tight and ached. Whenever she walked, at first, she brushed it off. "It's just the muscle settling," she told herself, "or maybe I overdid it yesterday." Days passed, but the discomfort didn't fade. In fact, her leg began to swell, and she felt a little more tired with each step. Linda's daughter, visiting for the weekend, noticed the swelling and urged her mother to call the doctor. "Don't take chances, Mom," she insisted. Trusting her daughter's concern, Linda scheduled a visit. Within hours, she was diagnosed with a deep vein thrombosis, a blood clot in her leg, likely triggered by the changes in her medications and her reduced mobility after surgery. Sitting in the exam room, Linda felt a mix of gratitude and surprise. "Even after all these years of nursing, I never imagined my own prescriptions could put me at risk," she admitted. "Now, I talk to my doctor about every new medication and pay close attention to changes in my body. I share my story not because I want to scare anyone, but because I want others to learn from my mistake and take action before it's too late." Linda's experience echoes the truth we've explored throughout this episode. Knowledge, vigilance, and honest communication are some of our best defenses. Her story isn't unique. Each year, thousands of seniors find themselves in similar situations, not because they're careless, but because life is busy. Routines become habits, and it's easy to attribute new symptoms to just getting older. But stories like Linda's remind us that we're not alone, and that there is always something we can do. Maybe it's starting that conversation with your doctor, even if you're a little nervous. Maybe it's sharing what you've learned today with a friend, neighbor, or caregiver. Maybe it's keeping a closer eye on your own health, or offering support to someone who needs a gentle nudge. And let's not forget about Sam, an active 80-year-old who took up walking after a hip replacement. He kept a small notebook by his chair, jotting down each new ache, swelling, or change in energy. When he felt a sudden pain and warmth in his leg one evening, he referred to his notes, recognized the warning signs, and sought care right away. That decision prevented a serious complication, gave Sam a sense of confidence that no one could take away or consider. Maria, who organized her medications every Sunday, reviewing instructions and side effects with her pharmacist. She discovered that a new herbal supplement could interact with her heart medicine, and together with her healthcare team, adjusted her plan before any harm was done. These stories may sound ordinary, but in truth, they are heroic. They are stories of everyday wisdom, perseverance, and the quiet courage it takes to speak up. Listen to your body and choose health again and again as we gather the threads of these stories. Remember, your experience, your attention, and your willingness to ask questions could save not only your life, but also inspire those around you to do the same. In our final segment, let's bring everything together, powering you with a renewed sense of agency, a clear call to action, and a reminder that you are the author of your health journey every step of the way. Ready to close strong and confident. Let's move into the outro together. And so, as we come to the end of our time together, let's take a deep breath and remember, the journey to better health is not made of giant leaps, but of small, steady steps you can take every day. Right where you are, no matter your age, no matter how many pills you line up in the morning, no matter how many aches or uncertainties you may face, you have a voice and a choice. Medications are powerful tools, sometimes essential, sometimes life-saving, but as we've seen, they come with risks that deserve your respect and attention. The good news is that you are not powerless. In fact, you hold more power than you might think. Being curious, being informed, and being proactive puts you in control of your story. So, what are the next steps you can take, starting today? Ask questions. Don't let hesitation or embarrassment keep you from starting that important conversation with your doctor or pharmacist. There are no silly questions when it comes to your well-being. Bring your medication list, share your concerns, and insist on clear, understandable answers. If something feels off, trust yourself enough to speak up. Your intuition is an incredible asset. Notice changes in your body. Every ache, every bit of swelling, every unexpected pain is a message worth paying attention to. Write them down, track them, and bring those notes to your appointments. You are the expert on your own experience. The more you share, the more your healthcare team can help make small daily choices to support your well-being. Move a little more, drink that extra glass of water, choose a meal rich in colors and nutrients. Rest when you need it, and surround yourself with people who lift you up. These choices are acts of self-respect and hope. They add up, shaping your days and your future in ways you may not see at first, but will absolutely feel over time. And perhaps most importantly, share what you've learned. Talk with a friend, a spouse, a neighbor. Forward this message to someone you care about. The wisdom you share can multiply, creating a ripple of protection and empowerment throughout your community. The more we know, the safer and stronger we all become. If this video gave you a new insight or a question to ask at your next checkup, please consider liking, sharing, and subscribing for more evidence-based, compassionate advice. Drop a comment below with your story or the question you'll bring to your doctor next. This is a community where your voice truly matters. Remember, every healthy choice you make, no matter how small, is an act of love for yourself, for your family, and for the life you wish to keep living fully and freely. There is no such thing as being too old to learn, to ask, or to change. You are never alone on this journey. Thank you for joining us and for your openness and courage. Together, let's keep believing in the power of our bodies to heal, to thrive, and to surprise us with new strength. Until next time, take care of yourself, stay curious, and keep walking forward, one confident step at a time.